Every single day, people walk into my office convinced one blurry eye is just dry eye. Then they tell me it cleared in 2 minutes. Most people see tired eyes and bad glasses. I see a vascular warning racing through the retina and neck arteries. In 15 years, I have watched TIAs, retinal ischemia, and carotid disease announce themselves over and over again after 60. The body gives you specific warnings before blindness, before speech loss, before the ambulance ride, and before a bigger stroke lands hard. Big Pharma and your appointment do not reward prevention because there is no billing code for it. They profit when you stay sick. Subscribe and hit like. I am telling you what they will not. Most people imagine stroke as a dramatic collapse. A face falls, a body drops, speech disappears, an ambulance comes. That picture is real. It is also incomplete. A great many stroke warnings arrive as smaller failures in the system first. A few seconds of imbalance. A strange dead feeling in one hand. A curtain of blur over one eye. A sentence that suddenly breaks apart in your mouth. These are not random glitches. These are dashboard warning lights. Your brain runs on constant blood flow. Not good blood flow, constant blood flow. When that flow is reduced, the medical term is ischemia. That means part of the brain is not getting enough oxygen and glucose to do its job. When a blood vessel ruptures, the medical term is hemorrhage, which means bleeding into or around brain tissue. In both cases, the brain loses function fast. It does not negotiate, it signals. Here is the mistake people make after 60. They assume a symptom only counts if it is severe, prolonged, or dramatic. That is wrong. A transient ischemic attack, also called a TIA, is a temporary blockage of blood flow. Temporary does not mean harmless. It means the warning light came on and then briefly turned off. The wiring problem is still there. The artery disease may still be there. The clot source may still be there. The next event is often larger. Think about a car dashboard. When the oil light flashes for 30 seconds, you do not celebrate because it went away. You understand the engine is warning you before damage becomes permanent. Your nervous system works the same way. Vision is one warning light. Speech is one warning light. Balance is one warning light. Sensation is one warning light. Strength is one warning light. The location of the symptom tells you which circuit is struggling. After 60, the background risk rises for reasons people are rarely taught clearly. The endothelium, that means the delicate inner lining of your blood vessels, becomes easier to injure from years of high blood pressure, smoking, diabetes, inflammation, and high cholesterol. Atrial fibrillation, which means an irregular heart rhythm that lets blood pool and clot inside the heart, becomes more common. Carotid plaque, fatty buildup in the neck arteries that feed the brain, becomes more common. Blood vessels stiffen. Pressure damages them. Small clots travel. Tiny branches close. Warning lights appear. Neurons, that means brain cells, are greedy tissue. They demand fuel every second. They do not store much backup energy. So when blood flow drops, the brain does not send you a polite memo. It disables a function. That is why a stroke warning is often not pain. It is lost ability. Lost words, lost balance, lost vision, lost sensation, lost coordination. That is the language of the brain. Nobody outside this video tells you the most important operational rule. If a neurologic symptom starts suddenly, treat it as vascular until proven otherwise. Do not wait to see if it becomes dramatic. Do not drive yourself. Do not sleep on it. Do not blame age before you rule out danger. Read the warning lights correctly. The first warning feeling is sudden numbness or tingling on one side that people dismiss as my hand fell asleep or my lip feels weird. In clinical practice, this gets minimized constantly. A person notices pins and needles in the cheek, fingers, arm, or leg. It lasts a few minutes. It fades. They move on. That is exactly how a serious warning gets missed. In medicine, this is called paresthesia. That means an abnormal sensation such as tingling, prickling, buzzing, or numbness. When it appears abruptly on one side of the body, it raises immediate concern for disrupted blood flow to the sensory pathways in the brain. The brain is wired in crossed patterns. The right hemisphere often monitors sensation on the left side of the body, and the left hemisphere often monitors sensation on the right. So a tiny interruption in blood flow can create a very specific one-sided warning light. Here is what actually happens. A small clot, a narrowed artery, or unstable plaque briefly reduces flow to the sensory cortex or deeper relay pathways. The neurons stop transmitting clearly. Sensation becomes distorted. The person feels detached from part of the body, not because the arm or face is damaged, but because the brain map for that body part is losing fuel. That is ischemia speaking. People after 60 especially ignore this if they already have arthritis, neck pain, diabetes, or old spine problems. They assume every strange sensation belongs to an old diagnosis. That is dangerous thinking. Chronic nerve problems usually follow a pattern. Stroke warnings arrive suddenly. They are abrupt. They are new. They are focal. That difference matters. How do you fix the mistake? First, stop calling sudden one-sided numbness normal. Second, check the clock immediately. Symptom timing matters because emergency treatment decisions are built around time from onset. Third, look for companion warning lights. Is the face uneven? Is the arm weak? Is speech off? Is vision altered? Even if the sensation clears, it still counts. A TIA is not a free pass. It is a fired warning shot. If numbness starts suddenly on one side of the face, arm, or leg, call emergency services immediately. If it resolves before help arrives, still go. Do not rub it away. Respect it. The second warning feeling is heaviness in one arm or one leg. Not agony. Not collapse. Heaviness. A person says, "My right arm felt dead for a minute," or "My leg felt like concrete when I got up," and then they keep going. That is not ordinary fatigue. That is a motor warning light. The medical term is hemiparesis, which means weakness affecting one side of the body. Sometimes it is obvious. Sometimes it is subtle. The hand grip weakens. The foot drags for 10 steps. A coffee cup feels strangely unstable. A stair suddenly becomes harder on one side. What matters is the sudden change. Let me explain the mechanism. Movement signals travel from the motor cortex through dense wiring bundles deep inside the brain. One of those critical corridors is the internal capsule, a compact highway of nerve fibers that carries movement commands. A tiny vascular blockage there can produce outsized weakness. Another mechanism is a lacunar infarct. That means a small stroke in the deep penetrating arteries of the brain. Small does not mean trivial. A small stroke in the wrong place can disable a major function fast. This is why the dashboard metaphor matters. The warning light is not pain. The warning light is reduced output. The arm does not obey cleanly. The leg does not launch cleanly. The brain is telling you its motor circuit is underperfused. That word, underperfused, means not receiving enough blood supply. People confuse this with exhaustion, low blood sugar, dehydration, or a bad night of sleep. Those conditions can make the whole body feel weak. Stroke makes the body asymmetric. One side feels wrong, one side lags, one side drifts. That asymmetry is the clue. The fix is not to sit down and see whether it passes. The fix is to test function immediately. Raise both arms. Smile. Walk 10 steps safely if you can. Say a sentence out loud. If one arm drifts, one leg drags, or the face changes, that is emergency territory. Even if strength returns, the event still counts as a warning of future stroke. Temporary weakness is not reassurance, it is evidence. After the emergency is handled, talk to your doctor about blood pressure, diabetes, cholesterol, atrial fibrillation, sleep apnea, and carotid disease. Those are the hidden wires behind the light. But in the moment, do not negotiate with sudden one-sided heaviness. Test both sides. Act. The third warning feeling is sudden dizziness, or a strange off-center sensation that people label as "I just got up too fast." Sometimes that is true. Very often, after 60, it is not. The dangerous version is abrupt dizziness with loss of balance, veering, clumsiness, nausea, or the sense that the room and body no longer agree with each other. That is a major warning light. In medicine, loss of coordinated control is called ataxia. That means the brain is no longer organizing movement smoothly. One major source is the cerebellum, the part of the brain that fine-tunes balance, posture, and accuracy. Another is the brainstem, which is the compact command center that links balance, eye movement, swallowing, breathing, and alertness. These structures are supplied by the posterior circulation, that means the arteries at the back of the brain. When flow there drops, the first symptom is often not face droop, it is disequilibrium. This is why people miss posterior circulation strokes. The symptom feels vague. I felt off. I was walking funny. I could not trust my footing. I thought it was my inner ear. Not every dizzy spell is a stroke, but sudden unexplained dizziness with imbalance, double vision, numbness, weakness, or slurred speech is a stroke warning until proven otherwise. That is the rule. Here is what actually happens. The balance network integrates signals from the inner ear, the eyes, the muscles, and the cerebellum. If blood flow is reduced to the brain's coordinating centers, the system loses alignment. The person sways, misses a step, grabs furniture, or feels motion without moving. That is not aging. That is a network failure. The fix is immediate behavioral discipline. Sit or lie down safely. Do not drive. Do not shower. Do not walk it off. Check speech, arm strength, vision, and facial symmetry. If dizziness is sudden and neurologic signs are present, call emergency services. If the spell clears in 10 minutes, the risk remains. Remember the dashboard. A warning light that goes dark on its own did not repair the engine. Nobody tells you how many strokes are missed because older adults were taught to normalize balance changes. Do not make that mistake. Protect the brain before the stumble becomes a fall, a fracture, or a major stroke. Stop, check, call. The fourth warning feeling is a sudden change in vision that people blame on dry eyes, fatigue, or just needing new glasses. This is one of the most dangerous rationalizations in medicine. Vision changes that begin suddenly are vascular until proven otherwise. Sometimes the symptom is blur in one eye. Sometimes it is a gray curtain. Sometimes it is a missing section of vision. Sometimes it is double vision. The medical term for double vision is diplopia, which means one object is perceived as two because the eye movement system is not aligned. A brief curtain, like loss of vision in one eye, is often called amaurosis fugax. That means temporary blindness from interrupted blood flow, often through the carotid artery or retinal circulation. Those are not eye trivia terms. They are vascular red flags. Here is the mechanism. Your eyes are not isolated cameras. They are extensions of the brain with a direct blood supply. If a tiny clot travels to the retina or blood flow drops to the visual pathways, the image breaks. If the occipital lobe, the brain region that processes vision, loses blood flow, part of the visual field disappears. If the brainstem eye movement centers are affected, double vision appears. Different circuits, same dashboard category. Warning light. What research and clinical practice both show is simple. Temporary vision loss is not reassuring. It is often more dangerous because people delay. They wait for the eye doctor. They wait for the next day. They wait until the symptom recurs. That delay wastes the one thing stroke treatment depends on: time. The fix is simple and non-negotiable. If vision changes suddenly, especially in one eye, or double vision appears out of nowhere, call emergency services. Do not drive yourself to an appointment. Do not assume it is a migraine if you have never had that pattern before. Do not assume glasses caused it. Vision is one of the brightest warning lights on the neurologic dashboard because it tells you the vascular system has already reached critical tissue. A symptom that lasts 2 minutes is long enough to matter. A symptom that clears is still a symptom. Do not wait for it to happen again. Now, before we go further, understand this. The body almost never sends only one warning light forever. When people ignore the small visual warning, the next event becomes speech loss. When they ignore brief numbness, the next event becomes weakness. When they ignore balance changes, the next event becomes a fall or a full stroke. The pattern is escalation. That is why nobody is going to tell you to monitor it at home. You act before the dashboard goes dark. The fifth warning feeling is when speech suddenly feels thick, slow, tangled, or strangely hard to produce. Many people say, "I was tired." Others say, "My mouth was dry." Others say, "I knew what I wanted to say, but the words came out wrong." That is not a personality quirk. That is a neurologic warning light. In medicine, slurred speech is called dysarthria, which means the muscles used for speech are not being controlled cleanly. Difficulty producing or understanding language is called aphasia. That means the brain's language network is failing to encode or decode words normally. These are different problems, but to the person experiencing them, both feel terrifyingly similar. Speech suddenly stops being automatic. Let me explain why. Language is not stored in one single dot in the brain. It is a network involving motor planning, comprehension, auditory processing, tongue and facial control, and breathing coordination. Reduce blood flow to one key part of that network and the sentence breaks. The person substitutes the wrong word. They cannot find a simple name. They slur a familiar phrase. They sound drunk without alcohol. That is the brain losing power in real time. This symptom is often noticed by family first. They hear a changed cadence. They hear hesitation. They hear garbling. The person speaking often feels normal inside the head and assumes others are overreacting. That is another dangerous feature of stroke. Insight is not always preserved. The fix is immediate testing. Ask the person to repeat a simple sentence. Listen carefully. Do not accept "I'm just tired" if the change was sudden. Check the face. Check the arms, check the eyes, then call emergency services. Speech changes that last 5 minutes still count. A TIA involving speech means the blood supply to language tissue was interrupted. That is not stress, that is ischemia with a microphone. After stabilization, talk to your doctor about identifying the source. Heart rhythm monitoring, carotid evaluation, blood pressure control, diabetes management, and medication review matter. But the moment the warning light appears, you do not troubleshoot at home. You escalate. Trust the speech change. Obey it. The sixth warning feeling is sudden confusion, mental fog, or a strange sense that your thinking has detached from the room. This one is missed constantly because people use soft words for it. Off, spacey, not myself, a weird spell. Those phrases sound harmless. The mechanism is not harmless. Acute confusion means the brain is failing a function it was performing normally minutes earlier. That can happen when blood flow drops to regions responsible for attention, sequencing, awareness, memory integration, or comprehension. The medical term perfusion means blood delivery to tissue. When cerebral perfusion drops in the wrong place, the brain stops organizing reality efficiently. The result is not always dramatic paralysis. Sometimes it is a person who cannot follow the conversation, cannot finish a routine task, cannot track the day, or cannot understand what is being said. Another important term is neglect, which means the brain stops attending normally to one side of space or one side of the body. A person may leave one arm hanging, ignore food on one side of the plate, or fail to recognize one half of the environment. Families often describe this as confusion because it is easier to say. Underneath it is a focal brain event. The reason this is so dangerous after 60 is that people excuse it with fatigue, grief, dehydration, medication effects, or stress. Those problems exist, but stroke has one signature feature people keep ignoring: sudden onset. The mind was functioning, then it changed. That timing is the clue. The fix is to stop using vague language. If a thinking change begins abruptly, especially with trouble speaking, imbalance, weakness, or visual symptoms, treat it as a stroke warning until a clinician tells you otherwise. Do not let the person nap. Do not wait for clarity to return. Do not let embarrassment silence the event. Confusion is not a soft symptom. It is a hard emergency wearing soft language. How old are you? Write it in the comments. I want to see how these warning lights change across the 60s, 70s, and 80s so I can focus future videos where you actually are, not where the medical system assumes you are. Age changes artery stiffness, rhythm problems, recovery speed, and how quietly the brain can signal danger. Write your age. Put it there. Do not call sudden confusion normal aging. Call it what it is: a warning light. The seventh warning feeling is a sudden severe headache that is totally different from your usual pattern. Not a familiar tension headache, not the dull ache you get from poor sleep. A new, explosive, abnormal headache. Many people after 60 call it sinus pressure, a blood pressure spell, or a bad migraine and wait. That is a high-risk delay. Why does this matter? Because not all strokes are from blocked arteries. Some are hemorrhagic, which means a blood vessel breaks and bleeds into brain tissue. Another emergency pattern is subarachnoid hemorrhage. That means bleeding into the space around the brain, often described as a thunderclap headache because it reaches maximum intensity fast. The person may also have vomiting, neck pain, light sensitivity, collapse, or confusion. But sometimes the first signal is simply a severe headache that feels profoundly wrong. Here is the mechanism. Bleeding increases pressure inside a rigid skull. That pressure irritates pain-sensitive structures, disturbs nearby brain tissue, and can deteriorate rapidly. This is why headache as a stroke warning is different from the other warning lights. It is often the one that hurts. The pain is the message. Now, keep this precise. Most headaches are not stroke. The dangerous category is sudden, severe, unusual, or associated with neurologic symptoms like weakness, numbness, speech difficulty, imbalance, or vision changes. That combination transforms the interpretation completely. The dashboard is no longer flashing one light. Several systems are lighting up together. That is urgent. The fix is immediate emergency evaluation. Do not take pain medicine and wait for feedback. Do not lie down and hope sleep resets it. Do not let pride or inconvenience delay care. If the headache is abrupt, extreme, and unfamiliar, especially if it arrives with neurologic symptoms, call emergency services now. And if you have recurring transient warning signs of any kind, talk to your doctor urgently about stroke risk factors before the larger event arrives. Treat the first thunderclap like the alarm it is. Move now. Here is the action protocol. Step 1. Respect sudden change. Stroke warnings are defined by abrupt onset. If a symptom appears out of nowhere, stop normalizing it. Step 2. Read the dashboard. Check balance, eyes, face, arm strength, speech, and time. Add numbness, confusion, and sudden severe headache to that mental scan. Step 3. Mark the clock. Write down or say out loud the exact time the symptom started or the last time the person was normal. Treatment decisions depend on timing. Step 4. Call emergency services immediately. Do this even if the symptom fades. A transient ischemic attack is still a medical emergency. Step 5. Do not drive yourself. Do not let a family member just watch you. Sit safely, unlock the door if needed, gather medications, and wait for trained help. Step 6. After the emergency is addressed, talk to your doctor about the hidden sources of these warning lights: blood pressure, atrial fibrillation, diabetes, cholesterol, carotid plaque, smoking, sleep apnea, and prior TIAs. That is how you stop the next alarm before it becomes catastrophe. Do not admire the warning light. Respond to it. Your brain is not your enemy. It is a messenger. Your strange numbness, your brief blur, your slurred sentence, your sudden imbalance, those are not betrayals. They are warnings. They are dashboard lights telling you that blood flow, vessel integrity, or clot risk is no longer stable. That is empowering, not frightening, because signals give you a chance to act. Silence is what kills. Signals save. If you learn to read them early, you change the timeline. You do not wait for the catastrophic stroke to educate you. You let the smaller message do its job. There is no billing code for prevention. There is no billing code for teaching people how to recognize a 5-minute warning light before it turns into disability. The system profits when you stay sick, not when you get well. That is why this information is not repeated often enough, clearly enough, or early enough. If this sharpened the way you read your own body, subscribe and hit like. Help this channel grow so more people learn these warning lights before the ambulance ride, not after it. And if you or someone you love has any of these symptoms suddenly, do not argue with them. Do not schedule them. Act on them.